for a long time now, we now understand how people have been using things like Google to self-diagnose their health symptoms, right? And now that there's an even more powerful technology, we were really worried that we wanted to understand how much more problematic, or maybe not, maybe it's more useful, how much more problematic would it be if people started using large language models for the same thing, for self-diagnosing. My name is Amulya Yadav. I'm an associate professor at the College of Information Science and Technology in the Department of Informatics and Intelligent Systems at Penn State University. Large language models that included a variety of large language models. They were found to be approximately 76% accurate as evaluated by our board certified physicians in answering questions reliably, right? And they were found to be amongst the different types of LLMs that we tried, that our participants tried. We found that ChatGPT was most accurate. Some other language models were were even less accurate. Compared to search engines like Google, it seems that large language models did way better at answering these health-related questions. These large language models were able to answer them much better as compared to standard search engines like Google and Bing, etc. The World Health Organization, the World Bank report that approximately 50% of the world population does not have access to proper healthcare. Right now, if you think about that half of the global population, the fact that they're able to get access to a medical chatbot or an LLM that can answer their health-related questions with a 76% accuracy. Based on our study, it seems that if we were to believe that LLMs are able to answer these questions with 76% accuracy, then the fact that anybody around the world can pay a $20 subscription, or maybe not even that, even if they want to use the free model, because many of the LLMs that we compared in the competition were free versions of these LLMs, right? The fact that they can use these LLMs to get health advice that is correct 76% of the times, and contrast that with the counterfactual which exists right now, where they don't have access to a doctor, right? That seems to be a wonderful thing, right? Especially to that half of the population where they don't have access to a doctor. So that's one way to spin it. Large language models at this point of time are not as accurate as a human physician, and therefore we should not, or we should be very cautious. That's our message to the general public, that we should be very cautious in using large language models to self-diagnose. And even if they were to do it, if anybody is going to use language models, it is much better off in the hands of physicians who know how to interpret the outputs, who know when a language model is saying something that is inaccurate versus saying something that is accurate, as compared to an average lay user, because there's also a whole lot of research that says that people trust language models more than they should. I was surprised in that they performed as well as they did, but certainly I think that we should all be very wary of trusting anything that comes out of a language model, because it is basically a random token generator, right? And so therefore we should be very careful. We should be interpreting everything that comes out of a language model, especially with regards to personal health advice, with a grain of salt. So what we found is that queries that pertain to the discipline of dermatology, queries that pertain to the discipline of mental health, and I believe queries that pertain to the discipline of internal medicine, they worked worst. And there's a good reason for that, right? I mean, because for most dermatological queries, a patient is required to send a picture of the particular area of skin that they're worried about and send it to an LLM. And we all know by this point that there's a big lag. There's a discrepancy between how good text-based language models are versus how good vision-based language models are. And vision-based language models are not as great as compared to text-based language models. I think by this point we've seen articles being published about how there are LLM, instances of LLMs encouraging people to commit suicide, right? Because of their known tendency of being sycophantic, right? They're wanting to agree with whatever their user asks them to do, right? Or to validate the user even though the user may be saying something that is objectively wrong. This is a known trait of large language models. And so due to a variety of, because mental health is this really, there are so many things that you need to do properly, right? There's a correct way of doing things that has been set. There are so many protocols that human counselors have to follow. Ear, nose, and throat queries, queries regarding, common colds, etc. All of these general health, the most basic queries that you would ask, LLMs were reasonably good at answering. And yeah, I mean, if you think about it, I mean, they were effectively, 75% or 76% of the queries that were part of our competition received very high scores. If the situation is that a person does not have access to any doctor, right, does it not make sense for them to get some imperfect help from a language model? I completely concede that that's a very valid, genuine use case for which language model should certainly be used. But my concern is more about people who can and do have access to healthcare. Do we really want to go down this path of removing the need for human doctors just because LLMs can answer? Should we ask them to answer? Right? There's this old adage: just because you have a hammer does not mean that everything has to be a nail.